that you are managing to keep yourselves preoccupied, particularly those of you who are living inside the NCR Plus bubble. Okay, today we are going to be interviewing a couple of mayors, namely Mayor Joy Belmonte of Quezon City and Mayor Francis Zamora of San Juan City, to find out the situation in their particular localities or cities, because Quezon City is the biggest of all cities in Metro Manila. Now, does the size become proportionate to the headache because of all of the COVID cases? I heard, I think, yesterday that Quezon City had some of the highest numbers. And San Juan City, on the other hand, if I remember correctly, and if you're a regular viewer of Agenda, you would remember that we had Vice Mayor Warren Villa, who said that while the mayor was recuperating from COVID-19, he had already given instructions for San Juan way ahead of the bubble to tighten up everything. So they started arresting people who were loitering, gambling, drinking, etc. And they even shut down a Zumba exercise group in the public plaza, in Pinaglabanan Plaza, if I'm not mistaken. Now, we'll go to all of those, and then later in the program, we will speak to Presidential Advisor on Entrepreneurship, Joey Concepcion, a regular on Agenda, to find out how does all of this affect them, because it was the business sector, the business group, who had been pushing for more lenient quarantine measures, opening of the economy, getting the vaccines, testing, etc. But it would seem to many we're back in square one. So let's find out from Joey Concepcion what their sentiments are, and is it maybe it's not going to work until we have the vaccine situation. We'll find out from Secretary or Mr. Joey Concepcion. Okay, now let's go to the front page of the Philippine Star. Today, Palace says there will be no cash aid or dole-outs despite the stricter community quarantine measures that have been put up in Metro Manila and 4 neighboring provinces. With the new protocols in place, government is eyeing a 25% drop in cases, and if things continue to get worse, Malacanang says lockdowns may still be considered. In other news, the proposal to ban some firms in procuring vaccines, like those selling liquor, infant formula, and tobacco, has been scrapped. Now, allow me to just make a commentary here. Hindi po kababalaghan yun. It is not some, imaginary thing. There are certain people who are, in their passion to fight tobacco, in their passion to reduce alcohol consumption in the Philippines, in their passion to promote breastfeeding in the Philippines. There are some people inside the Department of Health, and I know this to be a fact, that they have been really, they will resort to just about any possible measure to get back at those companies. And ang problema po, misplaced. It's misplaced because you want to get back at the company, but you are hitting and hurting the employees. Wrong. Okay, let's go now to the last piece. Chief Justice Diosdado Peralta bids farewell to the judiciary as he retires after 34 years of service. Justice Peralta, congratulations, job well done. I am sure that when the lockdowns are all finished, your presence will be felt yet again in the golf course. Okay? Ayan po si Justice. Actually, he did the smart thing. He retired early. Don't stay on the job until you drop dead or they have to drag you out of the chair. And Justice Peralta has done just that. He retired early while he can still enjoy his family, and let that be the lesson for the day, okay? If anything, COVID-19, the pandemic, all the lockdowns, the economic bust has proven to us at the end of the day, what matters most is our health, our family, our friends, okay? And the relationships. Yun po, kasi hindi naman nyo, sabi nga nung isang kilala ko na napapakinggan ko you never see a hearse towing a U-Haul. You cannot bring your wealth or your power to the grave. Oh, time to retire. Okay, let's move on forward. Greetings first to our friends in Palawan, Mr. Sunny De Leon, Mayor Marjo, and then of course sa mga tiga-Lemery, maraming salamat po for watching the program agenda. We appreciate, and mabuti naman na magbibigay na raw ng module, bagong module yung DepEd Lemery, kasi may mga nagpaabot na ng concern dito sa agenda na yung kanila daw po mga anak, wala na silang maituro kasi yung module hindi pa dumarating. But I received word na parating na raw bukas. Pag wala pa bukas, di tawagan na lang natin si Tita Tita Leonor, di ba? Okay. Now, I don't know if they're ready already, but let's find out. If Mayor Joy Belmonte is already available, I don't want to take up too much of their time because everyone is so busy this morning. Mayor Joy, are you there already?
Yeah, hi Cito, good morning.
Good morning. I am glad that you still managed to look so radiant and cheerful and smile. Alam ko, ang laki ng sakit ng ulo mo, Mayor. What is the situation for Quezon City, Mayor Joy?
Well, like I said a few weeks ago, even prior to the imposition of restrictions, it's already very alarming in Quezon City. And just to give you an example of what I mean, prior to this surge, we were averaging about 70 a day. And then the week after, at the start of the surge, we were already averaging 218 a day. And then last week, it was about 411 a day average. And this week, March 16 to 23, it's about 600 already on average a day. So that's quite a steep rise, and it's really very alarming here.
Okay, you ran for mayor to serve the people of Quezon City as a public servant. You're not a magician. You're not an angel. How are you going to deal with this? Kasi parang I think that's the prevailing question. How can mayors solve a problem that is beyond their pay grade?
Well, you just have to exercise some form of political will. In the start, for example, when I already noticed there was a surge, and while awaiting guidelines from the national government, we did what we could within our jurisdictions as mayor. Now, obviously, we have some autonomy, but we also wanted to respect the fact that in Metro Manila, the president and the IATF want us to have one voice. No? So having to wait for that one voice to actually get together and come up with some consensus. In Quezon City, we did some things that we thought we could do on our own, and that included imposing a liquor ban, for example. And that is based on data, because according to our data, the number one source of transmission is households at about 40%, and then 30% is the community, and the rest is already the workplace. So using that scientific data to back up some of the decisions, we figured a liquor ban would prevent people in the community from drinking outside in public. That because we know that in the communities, tagay-tagayan, Sito, tsaka alas 12 pa lang nagiinuman na. So I thought that would probably help. And then in the workplace, kahit na household sabihin natin yung transmission, kasi nga we're dealing with a new variant, napakabilis ng pagkahawa, but we already know that the workplace is the primary source, and we already issued guidelines about 2 to 3 weeks ago, issuing some very strict protocols in the workplace. And now, giving them some time to comply with this, I have now activated the joint inspection team, and they are supposed to be already going around the different identified workplaces where numbers are very, very high. And I've already said that if they have noticed that there is a blatant disregard for the health protocols that we have set in place in our guidelines, to already issue temporary closure orders. No, and apart from that, our contact tracing app, the QC Pass, we were very aggressive in implementing that. Before, businesses had to register on their own; it was very slow. Now, the city government proactively just assigned QR codes to our businesses. No, that's one. And I think another source of contamination for me is OFWs using or overseas Filipinos, no, using our hotels as quarantine facilities. No, but then these not being very strictly monitored, because we have received reports that they leave, they go out, or if they test negative, they're allowed to take public transportation and go home. No? And we already know that if you take the test at the wrong time, when your symptoms are not yet out, you could have a false negative. So
I remember you nearly had an aneurysm. Monti ka ng puto ka ng ugat when you discovered that an OFW had stayed in an apartel in Quezon City without the owners of the apartel informing the public health officer. Medyo, alam ko, talagang nagalit ka dun sa situation na yun.
And we continue to be very strict with regards to that. Like now, our policy is whether or not you test positive or negative, you cannot leave your quarantine hotel until you complete the 14 days. No? At kailangan pa rin, hindi ka pwede mag-public transportation pa uwi. Kailangan sunduin ka pa rin ng BERT ng iyong barangay, or kung hindi ka taga Quezon City, ng iyong local government unit. No? At yung katulad nga ng sinabi mo, Cito, the best way to enforce is really to enforce. It's not just to talk. You have to walk the talk. No? So we have already filed charges against 2 manning agencies that have been negligent with regards to looking after their OFW workers. No, one just recently, kasi itong taong ito showed up in City Hall saying, "Oh, help me," and then we said, "Ano nangyari? I'm positive, but my manning agency just said maghanap ako ng quarantine facility." No, and then he took the bus and went to City Hall. And can you imagine how irresponsible for that manning agency to allow this already known positive overseas Filipino worker, poor guy, had to take the bus and look for a quarantine facility by coming to City Hall. So that's just some examples of some of the things we've done.
Yeah, now, Mayor, just for clarification, kasi maraming nalilito, there's some speculation where the problem is really growing. You mentioned that most of it is at home or in the barangays and lesser in the workplaces. Kasi may mga iba, katulad dito sa Lipa, I'm here in Lipa, Batangas now, they're saying, "Sir, kasi ang daming tiga-Lipa bumabiyahe papuntang Manila, pumupunta doon sa mga factory dito sa paligid, mga ibang bayan, at umuwi din sa Lipa, nagkakahawahan." In Quezon City, you seem to have all the data, you seem to have the statistics. Where really is it coming from?
No, like I mentioned to you earlier, Cito, it's 40% the household, no? So, ibig sabihin nun, mabilis ang hawaan ngayon ng virus sa mga miyembro ng pamilya, which we did not observe last year, no? Last year, maybe 1 or 2 would be positive, but the rest would still be negative. Now, everyone, the entire family.
Yeah, but last year, we were also not letting people out. Well, now we are letting, and I'm not trying to blame anyone, Mayor, we're just trying to make sense of it. Is this because we opened the economy?
Well, no, Cito, let me finish first. I said it's household, but obviously the household contamination comes from the breadwinner or the breadwinners of the household bringing home the virus from the workplace. So I still put the culprit as the workplace, not the household, because may pinanggalingan yung sakit sa household, no? At maliwanag naman pati sa community, bihira kami makakita ng bigla na lang sumulpot sa community positive na hindi nanggaling sa isang workplace. Laging yung index case sa community, still may trabaho siya, hindi siya tambay at nanggaling siya sa workplace. Kaya I really identify the workplace as the primary source of the infection.
The bubble has not put a stop or restricted the movement of workers going from workplace to home. How do you then intend to solve the problem if the setup is still continuing, Mayor?
Yeah, so that's why we issued supplementary guidelines in addition to whatever the national government issues. Um, Imposing stricter health protocols within the workplace. So what are these
Mhm.
stricter health protocols? For example, hindi sila sana kumakain together, no, in the
Mhm.
pantry or in the workplace canteen. Sana you just eat in your desk and not with other
Mhm.
people, because you have to identify kasi circumstances where people take off their masks and are unprotected, no, and therefore at a risk, at great risk to other people. And one is when you eat, no, so yan dapat pagbawal yan, pinagbawal namin yan, no. Pangalawa is dapat sana hindi congested yung workplace, kaya bago pa man itong lumabas ng mga restrictions na ito, nag-impose na po kami ng alternative work arrangements sa mga workplace ulit, or flexible work arrangements, or yung team A team B style, no,
Mhm.
where para ma-decongest siya, no. So pangatlo, of course, yung ventilation. We encourage magbukas kayo ng bintana, wag yung aircon, no. At syempre yung QC Pass, napakahalaga yung contact tracing app para pag may nag-positive dyan, madaling ibalita. We also put the burden on them that they should have a COVID task force that knows all of the things that have to be done when there is someone in their ranks that have symptoms or have been exposed, no. And of course, yung immediate reporting to us right away, no. And also being responsible for themselves, no. Now we have identified even clearly now dun sa mga workplaces, ano pa dun sa mga workplaces ang mataas, no. So now we have identified about a third of the infections come from call centers, because ang dami dito sa Quezon City niyan.
Mhm.
And therefore, I have a meeting, but ayoko naman magpasara. Ayoko niyan, I'm
Siyempre.
very consultative. So ang gagawin ko, I have a meeting very, very soon within the week with the Call Center Association, especially those based in Quezon City, to just show them the data. And that is exactly what I did also with the Catholic Church last weekend. Bago pa man, again, nag-restrict ng religious gatherings, I already showed them the data. And I was happy because when I showed them the data, 2 weeks prior to that, they already agreed with me na dapat walang Lenten gatherings, lahat virtual na. And then when I showed them the data, they both agreed, both dioceses, na hindi na sila magkakaroon ng physical mass, no. And so I believe that also when you talk to the agencies involved, they are very intelligent, they are also very scared, and they are very
Yeah.
cooperative. So hopefully through talking and agreeing with one another, we can eliminate some of the problems, no, and we don't have to
Yeah.
really resort to force or to
Okay.
closures.
Mayor, I noticed that we did not talk about testing. Kasi I
Hmm.
remember when we were being very vigilant last year, hindi ka pwedeng pumasok sa opisina o sa factory na hindi ka na-test of one way or another. What is happening with the testing?
Well, here in Quezon City, we test about 3,200 now a day, which is more than we've ever tested, no.
Mhm.
But then there are also protocols kasi with regards to testing. Like I know many people, they depend on the antigen test.
Mm.
But then now we've learned. I was wondering why the DOH is not releasing guidelines pertaining to the antigen test. So therefore, the local government cannot procure kung wala kasing DOH approval
Aha.
or guidance. Nalaman natin na mataas pa rin pala yung false positives and false negatives doon sa antigen testing, no. So in the workplace, I would prefer not to just depend on a test, because we tend to be very complacent. And then kung negative, sasabihin natin negative, kampante na tayo. Yung pala
Mm.
false negative siya, no. So kaya ang aking panukala sa mga workplace, just follow very strictly the minimum health standards. Yung pagsuot ng face mask and face shield at paghugas ng kamay, that's already 90% of the
Yeah.
protection, you know. So
Correct.
and then it's better to be running scared and be acting cautiously rather than feeling kampante because you took a test that is not 100% accurate and then contaminating everyone. So that's my stand on that matter. But of course, if workplaces want to still have tests for their employees, that is their prerogative. But please do
Okay.
not forget the minimum health standards, even if you have
Okay.
tested.
Now, Mayor, my other concern, which I actually read on the headlines of the Philippine Star this morning, is that the government has announced no dole out. 2 weeks, medyo sabi ko, well, kung nakakatrabaho ang tao, no problem. But some people who don't have jobs and who will be locked down, will be expecting some sort of dole out. What will Quezon City government do in this regard? Kailangan ba or kakayanin ba? What's in the system?
Well, okay. Glad you asked that question. Now, here in Quezon City, last week pa lang, with the permission, of course, of my boss, Chair Benher Abalos, and I and the rest of the IATF, no, I had to issue an EO to close gyms and spas because we had outbreaks in our gyms. Because again, like I mentioned, we want to pinpoint businesses where you just cannot protect yourself. And gyms, obviously, you cannot. You take out your mask, no, and then you sweat, and then there's so much sharing of airborne particles, and then ganun din sa spa. When you go to the sauna, you take off your mask. You go to the jacuzzi, you take off your mask, and then you have a full body massage where the guy being massaged cannot wear a mask, otherwise he'd be suffocating because he's facing down. No? So in that situation, I set aside a fund, no, para magbigay tayo ng ayuda sa mga workers sa mga spa saunas natin tsaka sa mga gyms. No? Ngayon naman, 2 weeks walang trabaho yung mga ibang waiters kasi sarado yung dine-in, di ba? So I have already yesterday talked with the Philippine Chamber of Commerce Quezon City chapter and the Tourism Council of Quezon City, and I've already asked them to enumerate the names of their workers na mawawalan ng trabaho for the next 2 weeks, especially itong mga nasa dine-in, like waiters and probably some cooks, etc. And we will try to see what kind of ayuda we can give. But definitely last year kasi I already predicted that this year would be another ayuda year. I already knew it would be a very difficult year, that we would not be recovering this year. And therefore, the city government has set aside some funds. While wala yung 8,000 na SAP ng DSWD, still, tingin ko yung city government can probably shell out some funds or at least some goods to help these people. Yeah. So meron po tayo yan.
Kanina na pakinggan ko sa mga iba-ibang report na there are many hospitals are shutting down or denying access. What's the situation in Quezon City? And if all your hospitals get filled, are you planning to convert the multipurpose gyms in barangays into field hospitals? And if so, do you have enough doctors and nurses in Quezon City?
Actually, well, the situation in Quezon City is not very different from that of the rest of the NCR. I think basically when you see a trend in NCR, it's pretty much the same in all cities, more or less, no, because we're contiguous. So our hospitals, matagal na, may local hospitals, 3, puno na yan, yung ICU tsaka COVID wards, no. And yet we are compliant with all of the standards of the DOH. Talagang puno na siya. Yung ibang mga hospital naman natin, yung private and government hospitals, the last I saw the data, they were all in critical condition already, no. So one of course the strategies is mabilis tayong mag-step down kasi yung quarantine facilities po ng city malaki pa ang bakante, about 50% to 70% pa ang available spaces. So kailangan sana yung mga hindi naman critical at severe ang condition sa mga na nasa ospital, yung mga moderate at mild, wag na sana silang manatili sa ospital, bumaba na sila, mag-step down na sila sa ating mga quarantine facilities kasi meron pa naman tayong room in our quarantine facilities. And I'm building more quarantine facilities. Now, with regards to field hospitals, yung problema naman dyan, Cito, is manpower. I heard kanina that there are some hospitals that they can expand bed spaces. That's not a problem. But it's really the manpower, the lack of manpower, and of course, the exhaustion of our health workers. They are just human. And meron din silang mga frailties. Marami sa kanila nabakunahan, pero dahil it takes a few weeks for the vaccines to take effect, nahawa pa rin sila. No? So, again, manpower is a problem. And I think that until we can solve that problem, we will always have this problem in terms of fullness in our hospitals, na full capacity.
Mayor Joy, last question ko na lang, vaccines. Makakabili ba kayo ng vaccine? At saka, nabalitaan ko, ewan ko kung totoo ito, meron na raw mga senior citizen na nabakunahan dyan sa Quezon City. Ewan ko kung bali-balita, pero credible yung kaibigan ko, senior citizen eh.
Okay, let's put it this way, no? You could be a doctor but a senior citizen, correct?
Okay.
So therefore, if you are a health worker but you are a senior citizen or you are a frontliner, some of our barangay health emergency response team members are already in this. Pwede sila because if they fall into that category of frontliner and health worker, kasama po sila sa A1.1 to A1.1 to 7, 1.7, lahat po yan pwede na pong bakunahan. No? So they are not there because they are senior citizens, they are there because they are frontliners, and
Will
they
you
are
be
therefore
able
eligible.
will you be able to buy the vaccine directly, or what's the situation?
Well, just like all other LGUs, we ordered AstraZeneca 1.1 million doses. We've already paid our down payment. Hopefully, these will arrive in July as was promised to us. And then we are now there are only actually 4 pharmas willing to engage with local governments. These are Sputnik, AstraZeneca, Sinovac, and I think Novavax. And we are in talks with all of the other 3. No, and it seems like we are going to be able to purchase from the other 3. But having said that, also the national government has assured us that they actually have a supply for all of the citizens in order to attain herd immunity. No? So parang buffer na lang yung bibilhin ng city government, no? Just in case
Okay.
lang na may problema. But we will be fine if all of these that promise to deliver, we do deliver.
And I can say that the residents of Quezon City, the citizens of Quezon City, are in a good place with a mayor named Joy Belmonte. Good job, Madam Mayor, and thank you
you.
for your time this morning.
Thank you, Cito, at mabuhay po tayong lahat. Mag-ingat po tayo. God bless po.
Okay. God bless. Yan po si Mayor Joy Belmonte, and all the questions were answered clearly, and medyo gives you hope. Ano? Gives you hope kasi medyo talagang matindi ang labanan. We'll go for a quick break, and when we return, we speak with Mayor Francis Zamora of San Juan City. Okay, you're back here on Agenda. I'm your host, Cito Beltran, and you are watching us via Signal TV channels 8 and 250, as well as on Facebook.com/OneNewsPH, as well as YouTube. Let's go now to our next guest. Let's bring in Mayor Francis Zamora of the city of San Juan. Mayor Francis, good morning to you, sir.
Yes, good morning, Cito, and to everyone watching TV5 and One News and Agenda. Thanks for having me this morning.
Okay, mukhang talagang na-quarantine ka after getting COVID kasi namuti ka na naman eh. In any case, Mayor, what was the experience like for you, and what are the lessons you learned as a mayor dealing with going through COVID-19, the infection, and that?
Okay, last February 28, I underwent a routine PCR test. I often do this 2 to 3 times a month because I'm out every single day. I go around the different barangays. So I really have my routine tests regularly. And after the February 28 test, my results came out March 1, and they indicated that I was positive. But I was asymptomatic the whole time. In fact, I did not feel any single symptom, no cough, no colds, no fever. And I was in good physical condition, except that my wife is a cancer survivor. And even if usually you can indeed just stay home, if you are symptomatic. I was advised not to do so, and of course, it was also a personal decision, because the last thing I want is to infect my wife, uh, who is a cancer survivor. So I made the decision to quarantine myself in the hospital. During the time, the cases were still very low. In fact, in the wing of the hospital where I was confined in, I was just alone. Wala pang pasyente noon. No? So tinapos ko yung 14 days ko ron. Ang ginawa ko basically was to isolate myself. I was also being monitored by my doctors, because in some cases, even if you're asymptomatic for the first week, biglang lalabas na lang yan on the 8th day, 9th day, 10th day. So when I went beyond the 10-day limit, we actually made the decision to go all the way to 14 days. Yung World Health Organization kasi and the DOH have set a 10-day prescription period. If you're asymptomatic and after 10 days you remain asymptomatic, you can be cleared already. Pero ako, Cito, sinagad ko siya to 14 days just to be very conservative about it. And from day 1 up to day 14, I remained in good physical condition. And looking back, no, when I was finally discharged, nakabalik na ako sa work. Looking back, no, ang nakikita kong posibleng hindi natin masyadong nabigyan ng pansin, no, yung ventilation talaga. Because I really go out with the mask, I observe social distancing in all cases applicable, naka-face shield tayo, no? So maingat tayo in terms of that. But one thing that I guess is given little importance really is yung ventilation, na the possibility of even if you are just 4 persons in a room or just 2, kumain kayo, nag-meeting kayo, kahit magkalayo kayo, since nagsa-circulate yung hangin, talagang yung risk ng infection is there. And that's something I learned from my doctor, because every day for 14 days, nagkukantuhan lang kami about his experience, yung infections.
Actually, napangiti ako, Mayor, kasi it reminded me of the story of Mayor Alfred Romualdez of Tacloban. Sabi niya, Cito, I am so vigilant about face mask, face shield, etc. Then one day, nagla-lunch ako, biglang pumasok sa office ko itong kaibigan nating dalawa na nagkwekwento, and I couldn't, I was in the middle of my lunch, and little did I know that this joker had COVID-19 and infected Alfred Romualdez. So parang mukhang ganun din ang nangyari sa'yo. Mukhang may nakausap ka at nahawa ka.
Yes, I think ganun ang nangyari. No? Of course, ang problema, there's no way really to find out. Sito, from March last year hanggang nag-positive ako, araw-araw tayong umikot sa barangay, nagmo-monitor tayo, we inspect the implementation of all our COVID-19 ordinances. So I encounter a lot of people every single day, and syempre posibleng minsan yung na-encounter natin positive na pala, kaya lang hindi pa nagpapatest. Posibleng asymptomatic sila, so wala silang kamalay-malay na carrier na sila. No? Ito yung harsh reality ng COVID-19. There are instances wherein people really have no idea na COVID sila. In fact, meron nga natatapos ng COVID nila without them knowing. Nangyayari yan kasi walang symptoms na lumalabas. Never sila nagpa-test because pakiramdam nila wala namang dahilan magpa-test. No?
Yeah.
So yun ang nakakatakot sa sitwasyon na to, Cito.
Okay, now you while you were under quarantine, sinabi sa akin ni Vice Mayor Warren Villa na nagdesisyon kayong lahat sa konseho to tighten or to clamp down sa San Juan City. In fact, there were already operations sa mga iskinita, hinuhuli yung mga tong eats, pinatigil mo raw yung mga inuman sa mga kalye, and then also yung pati yung Zumba exercises sa pinaglabanan plaza, no? But right now, what is the situation in San Juan? Because I know some of your hospitals, or 1 or 2 hospitals in your area raw, filled up na. I don't know. What is the status of San Juan?
Okay, Cito, going back dun sa nung napasok ako sa Cardinal Santos, that was March 1. Ang kwento ng mga nurse doon, sabi, Mayor, kayo lang nag-iisa rito. Kaya sabi ko kasi, ba't ang dami yung nurse? Palit-palit yung na-assign sa akin. Sabi nga nila, sir, kasi wala naman masyadong pasyente. Alam mo, Cito, nung discharge ako ng March 14, hindi lang yung COVID wings ang puno, pati yung receiving tents, pati yung ICU na puno na. And that's within a span of just 14 days. No? And right now, we have 451 active cases coming from just 63 noong March 1. In fact, noong February, that was down to just 30. That was just a month ago. So naramdaman talaga natin yung surge nitong nakarang mga linggo. And ang Cardinal Santos talagang ramdam na ramdam din niya yung pagpasok ng mga pasyente. In fact, every single day, maraming tumatawag sa akin asking kung pwede magpatulong makapasok sa Cardinal. You know, I really politely inform them that I have no authority to do so because one, puno na yung mga COVID section ng Cardinal. That is our one and only private hospital here in San Juan. Next, yung ating San Juan Medical Center naman, meron pa tayong vacancy ngayon. In fact, 55% lang ang occupancy niya as of yesterday. Meron naman tayong Kalinga Center, which is our 120-bed quarantine facility in partnership with Xavier School. Yan naman po ay 85% full. And meron tayong San Juan National High School basketball annex. Yan po ay 65% full. By next week, we will be opening our container vans that were installed by DPWH. Ito yung project nila Secretary Villar ng mga quarantine facilities ng mga container vans. So, yan tamang-tama, makakadagdag yan sa facilities natin. So, yung hospitalization capacity natin in terms of sa Cardinal Santos, talagang puno na sila because you have to understand that people from other cities go to Cardinal Santos. Hindi naman yan purely for San Juan residents alone. Yung ating San Juan Medical Center and the LG quarantine facilities, yan, bulk of them talagang taga San Juan. Pero hindi naman kasi lahat moderate to severe cases dito. Karamihan talaga, just like me, no, asymptomatic and merong mga mild. So yung mga asymptomatic and mild, if they have sufficient space in their homes, they are allowed to quarantine sa kanilang mga tahanan. Ngunit kung masyado masikip at naghahati-hati sa banyo, sa kainan, sa tulugan, yun talaga 100% nililipat natin sa quarantine facilities. Allow me to mention also that the national government also allocates mga hotels, no, for quarantine facilities. So kapag napupuno na kami, we simply have to coordinate with the IATF. Meron silang mga nearby hotels within San Juan and Quezon City, yung mga within just a few minutes away from our city, no. Ito'y libre para sa ating mga mamamayan. So sa ngayon, hindi pa naman tayo punong-puno in terms of our local government quarantine facilities.
Okay, Mayor, I'm just recalling what happened last year, ano? And one of the big, hindi naman big issue, pero laging napapag-usapan, lalo na social media, yung mga kaso daw dyan sa San Juan noon was, especially in the private villages of Green Hills, medyo ang nangyayari daw kasi, laging pinapapunta yung maid, yung kusinera o yung driver o houseboy dun sa palengke kung saan-saan. And then pag umuwi, nagkakahawahan na. And I just spoke with Mayor Joy Belmonte and she was saying something similar. Magtatrabaho, pag uwi, magkakahawahan. How are you trying to contain not just the community infections or transmission, but yung inside the house infections?
Dito, halimbawa, no, dito sa North Green Hills where I stay, yung aming village association naglabas na rin ng memo, no, that movement among residents will be limited. At the same time, no, yung kung kinakailangan na merong pumuntang ng grocery, halimbawa yung kasambahay na inassign to go to the grocery, nililimit yan yung exit and entry back into the village. No? Basically, yung ganitong mga sitwasyon kasi nalalabas at pagbalik ay posibleng carrier na sila. That is not just within gated villages, but also within the general population because Walang pinakaiba yan, Sito, na ang lolo't lola natin nag-quarantine ng 1 taon, meaning hindi lumabas ang bahay ng 1 taon, ngunit yung apo nagtatrabaho sa labas. Pag uwi niya, kumain sila ng hapunan magkakasama, no? At eventually na-infect yung lolo't lola nila. It's really the same situation. That is why yung paglabas at pagpasok sa trabaho ng ating mga mamamayan, kinakailangan talaga with utmost care. Observe all minimum health standards, lahat ng mga protocols sundin kasi pag uwi niya, no, kung saan man siya nanggaling, whether you went to work, whether you bought groceries, whatever your purpose is for leaving the house, when you come back, you can always be a carrier already without you knowing it. So, mag-ingat lang talaga dapat. No? Kumaga dapat ang mindset nga natin, lahat tayo, isipin natin lahat tayo carrier. Diba? Pag lahat tayo carrier, isipin mo, imagine mo, carrier na tayo. No? Mag-iingat ka na kausapin yung mga mahal mo sa buhay because alam mong posible mo silang ma-infect. So, we really just have to be vigilant. The discipline starts from within. Sundin lang natin yung lahat ng minimum health standards. Mataas ang percentage na hindi tayo mahawa.
What's the situation with the public market, the San Juan public market, the well-known groceries and supermarkets in San Juan? Are you going to enforce or implement new and stricter policies?
Well, ngayon, nakalimit tayo sa 50% capacity. In fact, I've issued an executive order limiting yung operational capacity ng businesses. We increased that to 75% ng holidays. And Sito, no, I want to emphasize, walang naging increase sa number of active cases ng holidays. No? Wala tayong na-observe at all. In fact, we were expecting, but it never happened. That means nakakasunod talaga yung mga tao sa mga minimum health standards. Itong last 2 weeks lang talaga tumaas yan. And I believe malaking factor dito yung mga variants na pumasok sa Pilipinas. Yung variant, yung South African variant. These are highly infectious na mas mabilis sila makahawa. Both the Octa Research Group and the DOH have confirmed that they are indeed more infectious. So yun ang nakikita natin ngayon. No? Maraming infections, although mostly asymptomatic, mostly mild, pero nagpa-positive. Konti ang namamatay. In fact, here in San Juan, our death toll is 110 only. Siguro within this year, ang nadagdag dyan, probably less than 10 lang no? For 2021. Ibig sabihin, maraming na-infect, hindi naman ganun katapang o potent yung virus, but very infectious, nakakapaghawa talaga. So we have to really understand the dynamics of the new variant. Ito yung hinihingi natin ng tulong sa Philippine Genome Center, sa DOH, because possibly baka ibang interventions ang kakailanganin dito. But yung minimum health standards na face mask, face shield, social distancing, it's already 90% of the battle. Yung remaining 10 dyan, yung talagang extra effort na lang na mag-ingat talaga.
Okay, what you are one of the mayors who really strongly supported itong ang bubble na ito because you've always been a proponent for discipline and control of certain such problems. What happens now, Mayor Francis, if and please don't get me wrong, pero hindi ko kasi nakikita itong solusyon na ito as a bubble eh. It's more like an aquarium. I mean, you're a basketball player, you're an athlete. Pag sinabi kasi nating bubble, everyone in the bubble has been tested and is safe. So everyone is okay. Itong ginagawa natin dyan sa NCR and the 4 provinces, to me, is more like an aquarium eh. Parang lahat ng isda nilagay mo sa aquarium kung saan-saan ang gagaling. And the chances of controlling the disease or the virus is less likely. Now, what happens if we do not achieve the 25% reduction? At instead, sabi mo nga, and sabi ko rin, na itong variants na ito, can wreak havoc. Paano kung lalong lumala, hindi umigi? Are you going to call for a complete and total lockdown like suggested by some physicians?
Sito, yung bubble na terminology, no? that was construed by uh, the officials of the IATF, no? But
Mm.
if you talk about terminology alone, mahabang debate siguro yan, no? Kung yung terminology lamang pag-usapan. But I guess yung essence ng IATF Resolution 104 is really to limit yung movement ng tao.
Which we
Lalo na
support.
ngayon kasi since papasok ang Holy Week, traditionally people move around the country. And since the concentration of cases are here in Metro Manila, yung posibilidad na taga Metro Manila ka, lumipad ka papuntang probinsya nitong Holy Week at mailabas mo yung variants outside itong NCR, Laguna, Cavite, Bulacan, and Rizal. No? Yun yung nakikita kong gustong iwasan ng IATF.
Yes.
Why concentrate on these 4 provinces in NCR? Because data shows that most people who work in NCR are either from NCR or from these provinces. No? Ito kasi yung contiguous within Metro Manila. So ito yung siguro dinesisyon na lang i-control para nga itong within NCR and these 4 provinces, mas mabantayan at mas mamonitor. Now, limiting activities, halimbawa, yung dine-in, bawal nga for 2 weeks. Yung mass gatherings, dati na naman bawal. Yung religious activities, binawal. So it is a concerted effort of all LGUs and now including the 4 provinces to strictly implement these protocols with the objective of halting the exponential growth.
Yeah. In other words, double purpose. Huwag kumalat labas ng bubble at saka at the same time kung limitahan ng movement inside the bubble, baka naman bumaba yung mga kaso. Not necessarily stop it but reduce it. Anyway, Mayor, alam ko busy ka. Alam ko marami kang kailangan puntahan. Thank you very much for accommodating this interview, and I really hope that you guys stay safe, stay COVID-free, and please give our warmest regards and prayers to your wife. Alam ko yung feeling mo kasi yung sister ko tinamaan din. And pare-pareho na tayong mga cancer family. Anyway, thank you very much, Mayor. God bless you, Mayor Francis Zamora.
Thank you very much, Cito. And mag-ingat din po kayo. At sa lahat po ng nanonood, mag-ingat po parate. Maraming salamat po.
Okay, that's Mayor Francis Zamora of San Juan. Marami pa tayong itatanong pero talagang busy yung ating mga bisita. And we'll now go for a quick break. And when we return, let's speak with Joey Concepcion, Presidential Advisor for Entrepreneurship and #1 advocate for economy, for health, etc. here on Agenda. Welcome back to the program Agenda. We have 10 minutes left, and let's now go to Mr. Joey Concepcion, Presidential Advisor for Entrepreneurship. Good morning, Joey.
Good morning, Cito.
Okay, hope you are doing well. And I guess going straight to the point, what's your reaction to the bubble solution? Is it, would you agree that our experiment to open the economy has essentially failed? Or what needs to be corrected to continue with the opening of the economy?
First, I think the what the government is doing right now, I think is the right approach because Holy Week normally businesses are slow. People go out for a break for, so
Mm-hmm.
I think the real effect here is about 1 week now. Now,
Mm-hmm.
balancing lives and livelihoods using the new normal method of wearing of face mask, shields, and social distancing is very, very difficult. You can see if you focus on lives, then you affect livelihoods, and vice versa. If you focus on livelihoods, you focus on the lives will be affected, and that's why I've been always saying that and preparing that the real solution to saving both is really our vaccine program,
Mm-hmm.
and
Correct.
that's where we in initial stage we were doing all of this now. But since the vaccines have started to be developed and now we have secured vaccines for the Philippines, both government and the private sector, now we have to study and make sure that we get the right logistics partners and the right implementers who will do the vaccination because speed is essential. You may order it, we got to convince our employees to take the vaccines. Now, that's very important. We cannot afford that our employees will say will not want to. Earlier on, it was below 50%.
Mm-hmm.
Now, as we have all these webinars and our supervisors, managers, and executives are now part of the economic frontliners, it is much easier. So the confidence level has reached 80-90% already. Many of our employees wanting to take the vaccines.
Okay. Now, here's a question. Could you categorically, or I mean, can you just clear up this issue about vaccines? Because I've listened to some people in the business sector complain that, just let us buy the vaccines ourselves. Oh, it's too slow. We should be able to buy it directly. And I was saying, wait a minute, that was supposed to be a done deal since last month. Where are we really as far as the private sector, government, tripartite agreement is concerned?
It's all done. I don't know why some people can't understand that. With AstraZeneca, and in fairness to the national government,
Mm-hmm.
Secretary Galvez, us, and AstraZeneca forged the first tripartite agreement. It was definitely a win-win. Under EUA, private sector, individuals cannot buy these vaccines. That is
Mm-hmm.
common in the whole world. Even you can see it in other countries. Private sector is not buying the vaccines. It's the national government. Now, in this case, the private sector requested if we can join in buying the vaccines for our employees, and Secretary Galvez agreed, but it had to be a tripartite agreement under EUA. So uh, we started it with AstraZeneca. We have 17 million doses arriving, 2.6 of that in the second quarter, and the balance in the third quarter. Moderna also signed a tripartite agreement. The only difference with Moderna, they don't need to donate to the government. In that case, we donated to the government because we got this at a very good price of $5. AstraZeneca's program for nonprofit is for government. So for us to at least help the government, we decided to say, okay, donate part of that to the government. The government could not buy it at that point in time because
Mm-hmm.
AstraZeneca did not have MHRA approval or what they call FDA. No?
Yeah.
So we took that road. Now, Moderna, Novavax, Covaxin of Bharat, all of them will have to go under a tripartite agreement, which they have done, and there is no problem.
Okay. Now, what are your target dates, or when exactly are we going to see Joey Concepcion getting the vaccine? Your driver, your purchaser, whatever.
Well, that starts on the first batch of which was participated by 30 companies is arriving on May and June. No? But the
Mm-hmm.
bulk of that will be arriving towards the third quarter. No? Now, uh, we are economic frontliners are A4. No, in other words, you got A1, 2, 3, and then we're the fourth. No, so we are preparing for that. We have AstraZeneca the group who purchased it is going to tap Zwellig as our logistics provider. Moderna has tapped also Zwellig, and Unilab is with Novavax, etc. No? So we are all preparing for what we call now the execution. We are also preparing to really make sure that our employees take this vaccine. So we are really working on this, and I'm glad that Secretary Galvez has agreed that the managers, supervisors, and even the owners can be part of this vaccination program.
Yeah, Joey, what about the families? Because it's become a pattern. The employee will be vaccinated, but the families are not protected. And when some companies started talking about, oh, we're going to vaccinate our families as well, people were, like, so who will and who won't?
So some companies, there is a gray area here. Uh,
Mm,
the employees are going to get it free. Now, for the families, uh, s- uh, this I believe has to be given also for free because if we make the employees pay for their families, technically under EUA, my own thinking is that is not going to be allowed because it's like
mm-mm,
passing it on and retailing, and you may lose your control what
yeah.
who family and dependents. So if the companies want to give it to the family members of the employee, then it has, to my mind, it has to be given for free. Now, there is really no need to buy for your family members because they're covered by the LGUs. No,
Mm-hmm.
the LGU will give the vaccines free to its citizens. No, in the respective LGU.
Okay, there's just a request from our news desk. Kindly clarify this issue about whether or not the donation of vaccines to the government, I think it was 30 or 50% donation, was imposed or voluntary.
Now for AstraZeneca, the zero profit program is a very good program given to governments, and that was meant for the Philippines. But
Mm-hmm.
they could not participate in this zero profit program because, as I said, AstraZeneca did not have yet MHRA approval, which is the FDA approval. So we we volunteered. No, the private
Mm-hmm.
sector wanted to help the medical frontliners, and that's why we donated these vaccines to the national government. It was not mandatory. Now, for all the other vaccines, it is not being required. They're not asking for it. So Moderna, Novavax, and Covaxin, no donation is being requested. No.
Okay. Last question, Joey. What about the impact of this bubble? You already mentioned it's only going to be up to April 4, but if things don't improve, the government spokesperson has said that they may consider stricter lockdowns. What's your sentiment on that?
I think they will have to calibrate quite well, and it's very difficult to balance lives and livelihoods. But I believe it was the right time to do it this Holy Week, no? Because as I
Mhm.
said, the economic activity during Holy Week is low. But whether it's extended or not, I guess, I mean, they will have to see. If the cases still continue to increase in great magnitude, then it's a different story. That's something to be concerned of. But the way I see it, they will wait first and look at it. Now, the approach really right now is granularized lockdown, which is the right approach, which I recommended last year to the president, and it's been done, and I think it's quite effective. But of course, with these variants that are coming in, to determine whether this is the cause of the very high speed of infection. No, I mean it's really unusual to see so much of my friends really being infected. No, and people are dying. No, so that's a cause of concern. No, so. I think the whole world is realizing as we move towards this pandemic, there are many things that are coming are new, no, and
Mm.
while as the vaccines are coming in, some of them are less resistant to the these are less resistant to the vaccines, no, so that's an issue.
Okay, well, thank you very much for your time, and I do hope that all of your plans, ideas, and proposals bear fruit. And please stay safe and stay healthy. Thank you very much, Joey.
Thank you, Cito. Thank you again.
Okay, that's Mr. Joey Concepcion, Presidential Advisor on Entrepreneurship. And ayan po, nadinig naman ninyo, voluntary donation po yon, hindi po yon puwersahan. It was an offer of the private sector to assist government in the vaccination program, in the rollout of vaccines. And at the end of the day, we can argue, we can complain, we can do all the talking we want, but first, let's get the vaccine rolled out. And in the meantime, habang wala pa pong vaccine, mag-ingat po kayong lahat. Please, 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 no more discussion. The variants, okay, of COVID-19 is highly infectious, highly contagious, and you want to stay safe. So stay home, wash your hands, put on your mask, put on your face shield, and stay inside your own personal bubble if you can. Thank you. God bless all of you.